Namaste. I am Dr. Ashwath Acharya. I am the professor and head at the Department of Hand Surgery at Kasturba Hospital, Manipal. So I'll be talking about some of the common surgeries we frequently do in our practice. We often come across a lot of patients who come with the amputation of the fingers, which may happen because of various types of accidents, knife injuries, road traffic accidents, and so on. And one of the often questions which our patient asks is, how do we transport the amputated part to the hospital? We often see it transported in the wrong method, because of which we often fail in joining the amputated part back to the body. So what should we actually be doing whenever we have an accident like this, knife injury, cut injury, road accidents, and so on? So the immediate step which we should be doing first is to retrieve the patient to a safe place. Wherever the bleeding wound is, wrap it with a cotton cloth or material and ask the patient to keep it elevated, right? And in the meantime, make an effort to retrieve the amputated part. And what do we do with that amputated part? If it is in a nearby where you have a tap available, wash it with clean tap water. Otherwise, you try to get the amputated part. So this is the part, let's presume, and then you put it in a plastic sheet. Okay, wrap it and immediately surround it with ice cubes. Get some ice or ice pack, and then with the patient immediately transport him to the nearest referral center or the first aid center. Okay, so another very important point which I would like to stress is not to give any food or water to the patient immediately, because that will have problems for anesthesia later on, because our aim and effort should be to join this part as quickly and as early as possible. So with the patient and with the amputated part kept in the correct way, you can transport him immediately to the center where the doctors will do the needful. So as soon as the patient reaches hospital, we make efforts to join the part as early as possible. So we make the patient fit for surgery. One of the important part of the surgery which helps us in joining the part is, since it's a very small part, we use the microscope, which enlarges all the structures here, even the tiniest structure, by almost 10 to 15 times. So which makes us possible to repair the blood vessels, nerves, and fix the fractures and repair the tendons. Okay, so generally if it is a clean cut wound, the results are very good, and one of the important factor which decides is the correct time of arrival at the hospital. In this way we can do surgeries even at around 24 hours time. Okay, so that is the limit beyond which it's difficult to do a reimplantation surgery. Thank you.